So if Congress gets a report saying that here's what therapy does and here's what therapy saved in terms of downstream expenditure, those savings that therapists do don't have to be dynamic anymore. It's not pie in the sky. It's the experience of what happened when you did this. So that can actually insulate us, because every time they try to cut us in the future, we can point to it like, hey, if there's less therapists, you know you're going to spend more here because it's your data, not mine. It's not sponsored by APTQI. So that's what they need. Like, it's their own data that shows it. It's kind of like, Congress is always skeptical about, the studies that show milk is really good for you, and it's sponsored by the dairy farmers. Like, it's a little, yeah. But so this is like, we can keep telling them that, but it has to be in their own data.
Today's guest is someone who's dedicated to advocating for better healthcare policies and improving the lives of older Americans. Nick Patel is a physical therapist and the executive director of the Alliance for Physical Therapy Quality and Innovation, APTQI. Keep that in mind. They're a group working to shape the future of physical and occupational therapy through advocacy and policy reform. Now, Nick's an expert in healthcare policy, and he's here today to talk about an urgent issue: fall prevention. As falls continue to be a major risk for older adults, Nick and the Alliance are championing the SAFE Act, a piece of legislation designed to increase access to fall prevention programs and screenings for Medicare patients. In today's conversation, we'll hear why this issue is so critical, the role of PTs and OTs play in preventing falls, and what steps Congress can take to make fall prevention a national priority. And here's the kicker: you got to do something too, because without your voices, this might not go anywhere. Stay with us, because this is PT Pintcast. Nick, welcome to the show, man. Good to have you back.
It's great to be back. Thanks for having me. It's been a while, Jimmy. How you been, man?
So I mentioned it in the intro, but give people a little bit of context. I sort of told people your title and stuff like that, which is sort of ambiguous, right? It's just a lot of these big words.
It is.
But what do you get to do? What's sort of the purpose and the things that you accomplish in your role?
What I get to do is work with some of the best operators of outpatient physical therapy in our industry. And, the best way to describe it is, sort of corralling all the great ideas that these folks have. So our members represent the actual companies, and the people who sit on our board are the executives for those companies. So it could be the CEO, it could be the operators like the COO, it could be the compliance folks. We have a real kind of variety. And as you can imagine, whenever you get that many people into a room that all know therapy really well and all live and breathe this stuff, someone's got to kind of corral them all together and try to find a direction for all these wonderful thought processes. So that's in a nutshell what I do.
Yeah. So you got a bunch of people who sort of can see outpatient physical therapy from a high level. When they get in the room together, they're all probably very, very familiar with each other's problems, right? Because they probably have the same problem. And then it's time to talk about it. So one of those things that we get to look at on another macro level is falls, increasingly becoming a major issue for older Americans. And because I know how to read some census data, we have more older Americans, which is actually a good thing. We still have a lot of people around.
Right.
Give me a sense, though, from a big picture of just how big this problem is and why is it getting worse?
Well, how big it is probably summed up best by this stat, which I think still surprises people. Falls are the number one cause of death, injury, and fracture in people over 65 in our country.
Wow.
And most of the time people will say heart attack or stroke or cancer, which are all horrible things. But the number one stat is the number one cause is falls. And that's the emotional and pain, and the grief that it causes. Then there's the money side.
Sure.
And these numbers are also mind-boggling. We spend $50 billion a year annually in medical costs due to falls. And that's where we are in 2024. By 2030, we'll spend $100 billion per year on medical care associated with falls. So that's why this particular issue needs to have some solutions thought up.
Yeah. So why is it getting worse? Is it because we have more older adults and they're going to continue to age? Is that one of the reasons? Are there more?
I have a pet theory about that, and it sounds tongue in cheek, but I mean it kind of seriously, which is, Jay, if you have a heart problem, you know exactly who to go to. You're going to go to a cardiologist. And if you have, cancer in your family, you're going to seek out an oncologist when you get that, colonoscopy or MRI or whatever. If you ask most people over 65 in our country who the fallologist is, they don't know. And that's part of our fault. Part,
Right.
we don't get the word out, but part of it is, we just they're for such a huge cause of all this, pain and suffering and death. There isn't that automatic in your head as a consumer of that's the healthcare professional I should go to. But as I said many times on the Hill, we are the phallologists. Therapists are the
I
phallologists. If we
like
just
that.
rebranded ourselves like that, maybe more people would seek out care for it, and we'd bend that curve a little bit.
Yeah. As a communications marketing guy, I love fallologist, being very,
Yeah,
very clear to the point. And this is what I do. And this is one of the things that I get to do. Well, let's talk about some fallologists. How can PTs play a leading role in reducing these falls? So we maybe could get that off the top of the list as the leading cause of death and mortality. And hey, listen, nobody likes to spend more, because if we're spending a lot on this, we can't spend on other things. So how could we
correct.
play a better role upstream in reducing fall risks for older adults? And then why are we actually essential? I mean, you're talking to the choir here, of course. So by all means, preach and make us say amen. But why are we essential to solving this problem?
Well, I think of it this way. I mean, the a lot of the causes for falls are absolutely in our wheelhouse as PTs and OTs, because as I say, OTs are people too, right? So we have a unique scope of practice that deals
Sure.
with things like balance, strength. Think about like the home care setup and like the way someone's house, because the home is the most common area where people fall, but like how to make your home more safe for you.
Yeah.
Again, that's totally in our wheelhouse. The actions that people are doing when they fall are usually transitional activities. Getting out of the bathtub, getting out of a car, getting on and off the toilet. Again, if we are not the best people to teach people how to do these things safely, who
Who
is?
is?
Like
Right.
it has to be that we own those spaces. And so from my point of view, we know that stuff. We do implement it. Unfortunately, we use most of those skills after people have already fallen.
Yeah.
We are great with decreasing the fall risk for a patient that comes in tomorrow who's already broken her hip,
Right.
because they tell us they broke their hip and we say, great. We can help you with your broken hip, but we're also, you told me you did this because of a fall. Well, we can do all these great things for you to make sure you don't fall again. And I'll remember one time, and specifically, I was probably really early on in my career. I was maybe 6 months in, and I told this wonderful lady about how I was going to help her with her hip, but because she fell, I was going to decrease her fall risk by doing all those things. And I'm in my head thinking this woman's going to love me and it's great. I'm already picking out what flavor of bread she's going to bake me and stuff like that. And I'll never forget it. She looks at me and she goes, "That's great, dear. Sure would have been good to know that ahead of time." And it's just the simplest statement, but it
Yeah.
always struck with me. And I heard that 20 years ago. But if what we do with people after they fall is effective to decrease future falls,
Right.
why can't we move ourselves upstream a little bit and get at them before they had that massive injury and the pain and the cost and all that kind of stuff that happens? So that's sort of where I believe we need to kind of focus on a little bit.
All right. So let's talk about this SAFE Act, right? That you're advocating for. Like, help me understand, like, big picture. What is it, and how would it do the thing, or should have done for that woman 20 years ago?
Right.
How would it help us do the thing, which is prevent falls among older Americans?
So what it would do is it's a very simple bill. First of all, I love bills that are less than 4 or 5 pages,
Love
because
it.
that means they're not super complicated. And this one isn't. It's very simple. We have already a benefit for Medicare called the annual wellness visit and the medical and Medicare benefit, which means like once a year, so once every 12 months, any Medicare beneficiary can go into their physician. Usually it's an internist or a family practice doc, and they get a free visit. So it's not nothing out of pocket to them,
Okay.
and they get screened for all these issues. You get your blood work done, no cost to you. You get, a cognition screening done, no cost to you, blah, 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 all this stuff, right? And then if something comes out of that visit, if your physician says, tell me about your family history, and they say, you know what, my dad's diabetic, my mom's diabetic, blah, blah, that physician may say, let's go get your A1C checked out. But don't worry, no cost to you, but someone else will do that. Maybe you have a family history of cancer. You should go get a mammogram once a year. It'll be no cost to you. Get it done. Colonoscopy once a year, no cost to you. Get it done. In this annual wellness visit, the physician usually does something like a time get up and go, or some kind of fall screen, or ask you like, have you fallen in the last year? And they'll
Right.
check a box and they'll say that, hey, you're at a higher risk of falls. and then the conversation stops.
Right.
Unlike with diabetes and cancers, the conversation just stops. But what this bill does, in essence, says if during this visit your physician determines you fell once in the last year, that patient automatically becomes eligible to go to any PT or OT and have a fall risk assessment done. Not just a time get up and go,
Right.
but let me test your strength, let me test your balance, let me check your inner ear, talk to me about your home environment. This could be done in their home or in our clinic, and that will be free. That visit will be free to the patient, just like the other items that we try to do to stop a cancer or a diabetes diagnosis. It'll be no cost to them to incentivize the patient to
Sure.
go. So it puts us before they had that massive injury. So now, if you have them and they come in and the visit's done, you give them a great home program, you give them instructions on how to make their home safer. That makes that patient better off, because it's not just being told, hey, you're a fall risk, but now they have something, and the person that's giving it to them is the healthcare provider that does this like every single day.
The fallologist, putting
The
the
fall,
person at risk
right,
for falls in front of a fallologist.
right.
So if therapists are nodding along, right? Again, I said, Nick's over here preaching to the choir, everybody's just screaming amen. But how can they get involved themselves and along with their patients in supporting it? Because I like simple, I like clear, I like value, but these things don't just happen, right? You might put up a great idea. If there's no support behind it, doesn't do it. So talk to me from like a tactical perspective. Like, what do people actually need to do to make sure this thing doesn't fall off?
Hey, where are you going with your PT career? That's not rhetorical. I want to know. Would you like to embark on an extraordinary patient care adventure? That's what they call it. Some people might call it travel therapy. Find out more at jacksontherapy.com. This is perfect for physical therapists who are eager to make their mark. Discover where your skills can take you at jacksontherapy.com with Jackson Therapy Partners. And here's a question for you. You frustrated with your EMR? Feel like it should do more, be easier? Yeah. Take the next step. Maybe try something new. How about an EMR that's all in one? Seamless integrations of patient portals, marketing automations, and billing, all at an unbeatable value. Plus, switching over is a breeze. See what you can do with MW Therapy and their all-in-one EMR at mwtherapy.com. And how would you like to boost your bottom line and help more people? You can do both of those things without having to work more. Smarter, not harder, kids. Boost your clinic's revenue by $290 per patient per quarter by adding remote therapeutic monitoring. You've heard about it, but you're like, I don't know where to get started. Is it complicated? But what if you knew where to get started and it wasn't complicated? That's what Physiotech is here for. Kickstart your RTM at physiotech.ca. That's physiotech.ca right now with Physiotech.
No pun intended, right? So a couple things, and the simplest things are the ones that most of PTs are used to doing, because we've asked people to do it many times. And you can send in letters to your member of Congress. It is a bill right now. The bill number is HR 7618. It's a bipartisan bill, and it's if you go to aptqi.com under the Take Action tab, you'll see letters in there that one's written from the point of view of a therapist, one's written from the point of view of a patient. So, you got patients that feel strongly about this, give them the link, have them fill it out. Other therapists in your clinics can do it. That's the easiest thing. No sweat off your back. Put your address in. Honest to God, it takes maybe 30 seconds tops for you to do it, or a patient to do it. But then there's some next level things that you can do that I think maybe we don't do as good a job. We're great at sending in letters, but I think therapists can do a little bit better job about this. You kind of alluded to this earlier, and I talked about this, is we have this communications problem that we're not associated with falls.
Right.
And both from a consumer point of view, but also from a legislator and decision maker point of view. And so one of the things that we've done at APTQI is we've probably hosted about 20 so far, members and staffers of Congress to come into our clinics. And guess what we do? We do a fall risk assessment on them.
Yeah.
We're like, hey, let me show you what we do. And we've had a lot of people leaving the clinic saying, I did not know that this is what you guys do all the time. Put them on a balance master. Tell them to stand on one leg with their eyes closed. Show them how their setup of a house can dramatically increase or decrease their risk of falls by the angle of their recliner or the height of the toilet seat, or some really simple things like put some bars here, or stuff like that, that you second nature to you, but they need to know it.
Yeah.
And I think that places in their minds, oh, this is what PTs can actually do, or this is what OTs can actually do. And you got to have that, because letters are one thing,
Right.
but saying that my healthcare staffer, I personally went to that clinic and they showed me what they do. And they actually showed me that I have some fall deficits that I didn't even know I
Right.
had. And let's face it, when you're talking about that over 65 demographic, that includes a lot of members of Congress. They probably are very curious about what that would look like. So get them in your clinic. And that is, I'm not saying it's super easy, but it's super fruitful. And
Yeah.
if you get, if you invite, every clinic's got 2 senators and a member of Congress, of the House in their district. We're lucky at APTQI. We have a lot of multi-state large members. So we've gotten about 20 to come in just from the summer up till now. And we have more lined up before the end of the year. So don't underestimate just showing someone what therapy does and how powerful that can be by putting them in your clinic.
Yeah, and that show where, listen, everybody's favorite day in 3rd grade was show and tell. You wanted to do more of the showing because that got more attention, that told a better story. So by all means, I feel like show and tell in your example is the show is very much, hey, wouldn't it be great if you could do a fall assessment on your senator, like your state senator? Like, wouldn't that be amazing?
Correct.
The tell is not, not important, but those are the letters, right? Because understanding your audience is really important, and people in elected positions, their job is to make sure that the people in their districts or their states are heard, and understanding how many of those people this can affect when you show them. And just a couple of the stats that you had mentioned in terms of cost or number of people affected, now that's easy to remember. Later on, when this thing comes up, they're going to go, hey, I remember that was pretty impactful. This is kind of a big deal. This sounds simple, but as you mentioned, it's not easy, but it feels like it's worth it.
Yeah. And then you've kind of placed your profession, not just you yourself individually, but now you've placed your profession in that person's head as, I know what these guys do now. Because for good or bad, therapy, we practice in so many settings. We do so many different things. If you ask 10 people what a physical therapist does, you might get 7 different answers.
Right.
And probably none of them are going to be like a falls expert. You'll get works with my kid in their school. You'll get, I saw them in a hospital. You'll get, and they work in SNFs. You'll get, I hurt my foot and they helped me there. But they'll have all these things, but and that's because they personally experienced it because they were shown it, but they haven't been shown this yet. So your show and tell analogy is spot on.
Yeah. And none of those 7 definitions of PT are wrong, but we got to make sure. I don't know, man. I mean, maybe I walk around at CSM with fallologist merch and just start selling that, but it feels like that's a really good way to say we do that. This is something that we do.
Yeah, I'll only charge you like a 5% royalty.
I'm in.
Go for it. I'll hawk it. Let's go.
So what's the deadline on this? Like, when, if we just say, hey, do it, whatever, you and I both know no one's going to do it, but we need to put a measurable and specific goal on this. By when do PTs need to act to make sure this is heard?
For maximum effectiveness, as you may have heard, we got an election coming up in less than 2 months, which means that this congressional session ends early January of 2025, and so any legislation, anything last minute they're going to pass is probably going to be all put together probably around November, right? And then they'll have their mad rush before the holidays to get it done. So for peak effectiveness, we need to have our voice heard as much as possible between now and the end of October. That's really like that window. If we don't get it, doesn't mean it's end of the world. It just means we have to start all over again because there'll be a brand new Congress starting January 2025. We got to reintroduce the bill and start from scratch.
Perfect. APTQI.com. Did I get that? I did, right?
That is perfect.
I got it. All right. That's where you can find more information. Nick, is there anything I didn't ask about that you want to make sure PTs knew?
The other thing that I just wanted to highlight again is, while I'm preaching to the choir, take a second. There's a second provision of the SAFE Act that I think is really important for us to understand. And the reason we put that in there was to help solidify and protect us against these cuts, which I know we are all dealing with, and we're all facing. So quick lesson on governmental accounting methods. When we get cut as therapists, the government on paper will save money because they're paying us less. Now,
Okay.
you and I and the choir understand that we are low cost providers. And when you take out the low cost provider, or if you decrease their ability to do their job, the entire healthcare continuum probably spends more money downstream. And that's not good for us. But the problem is, accounting wise, it's really hard to dynamically score what a physical therapist does. And so when you cut therapy, that saves money. When you increase cost reimbursement therapy, that costs the government money, and that's a coster. So one thing that we did with this bill is we said, if we get this bill passed, the second provision, which is only a paragraph, says if this goes into effect, this new benefit for seniors goes into effect, the government needs to track the people who fell afterwards and compare, like, the folks who had this screened by PT or OT and the folks who didn't. What happened to the nature of falls and to the incidence of falls and things like that? And are we spending more for people who don't get, a fall risk assessment and those that do? As you will probably understand, the people in the group that had that fall risk assessment will probably fall less. And we've done some backwards analysis, pretty heavy math on that. And we know that that's true. If people who've had therapy after a minor fall have a 50% less likelihood of falling again in the next 6 months to the level that requires an ER or a hospital visit. So we know that happens. So if Congress gets a report saying that here's what therapy does and here's what therapy saved in terms of downstream expenditure, those savings that therapists do don't have to be dynamic anymore. It's not pie in the sky. It's the experience of what happened when you did this. So that can actually insulate us, because every time they try to cut us in the future, we can point to it like, hey, if there's less therapists, you're going to spend more here because it's your data, not mine. It's not sponsored by APTQI. So that's what they need. Like, it's their own data that shows it. It's kind of like, Congress is always skeptical about, the studies that show milk is really good for you and it's sponsored by the dairy farmers. Like, it's a little, But so this is like, we can keep telling them that, but it has to be in their own data. So if you can make a dent in a potentially $100 billion a year problem, they're probably going to think twice about cutting you next time around. And so that makes it just a little, it's nothing else changes about, the need for our patients. But if you're sick of the cuts, and if you're sick of Evo's being told that therapists, have to take the brunt of all these cuts because we have to save money as a country, blah, 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 this is our way to show that not only can we help the patient outcome, but we can help the financial costs for the healthcare system as well, and get credit for it. Crying out loud.
Keep preaching. That's what PTs like to hear, but we need to do something about it. Talking to each other is good, but the show of someone else needs to be shared. Nick, last thing we do on the show is we call the parting shot. What's a mic drop moment, soapbox statement, idea or concept you just want to leave as we wrap up?
Oh man, mic drop moment. I would, I'd say this. There are, like I alluded to earlier, $100 billion, number one cause of death and injury. But the one that always sticks with me is a person over 65 in this country. They fall every second.
Wow.
We've been on this podcast for about a half an hour. Think about how many people have already fallen.
Wow.
And so there's numbers that are big in terms of dollars, and there are percentages that are big, but every second, that's what it equates to. And we have to do something about it. And if it's not the fallologists of the world screaming about this, like who would do it?
Who's doing it? All right. Yeah. Nick, thanks for putting this in perspective. Thanks for doing what you do. And hopefully we can get a couple people. We'll share the link in the show notes that people can actually take that step. Because even if we can get 100 people to take that step, it's 100 more that wouldn't have been there yesterday. Nick, for APTQI, appreciate your time, man.
Thanks, Jimmy. Have a good one.